Hello and welcome back to Helpful Tips for Healthy Aging. My name is Anna and I'm a health promotion major at the University of Georgia. In this video, we will discuss understanding and managing common symptoms of chronic disease. Although certain symptoms are common among those with chronic illnesses, they affect each person in different ways. Learning about common symptoms, their causes, and self-management tools can help you to best deal with your chronic disease. In order to understand and manage your chronic condition, it is important to be able to recognize common symptoms. These could include, but are not limited to, fatigue, pain, shortness of breath, sleep problems, depression, anger, stress, memory problems, itching, or urinary incontinence. In this video, we will go through each symptom and describe self-management tools for each one.
Fatigue or feelings of tiredness can have a variety of causes. These can include the disease itself, inactivity, poor nutrition, not enough rest, medications, or even emotions. With so many possible causes, it may be confusing on where to start. One tool that can help with this is utilizing a journal. Journaling your symptoms throughout the day can help you to identify where the fatigue is coming from. Knowing the root of your symptoms can help you to know the steps to take to best manage your symptoms.
Pain is another common symptom people experience when dealing with a chronic condition. As with any of the symptoms we mentioned, there can be many different causes for the symptom. Causes of pain can include things such as the disease itself, tense muscles, muscle deconditioning, lack of sleep or poor quality of sleep, stress, anxiety, and emotions such as depression, anger, fear, and medications. One way to regulate pain levels is to utilize the pain gates method, also known as mind-made medicine. The brain can control how pain is received and its response. While this may not be an immediate fix, changing your mindset is a great way to start to take control of your condition. Some ways that the body and mind interact include the following. Inactivity. Pain can cause you to avoid physical activity, but this is counterintuitive in managing pain symptoms. Avoiding physical activity can cause you to lose strength, which in turn can cause you to become more frustrated. Overdoing. While it is important to stay active, it is also important not to overexert yourself. Remember that physical activity is supposed to help your chronic condition, not worsen it. Misunderstanding. Your symptoms are valid, even if those around you do not understand them. This doesn't mean it isn't frustrating when your peers doubt you. Overprotection. While some of your peers may misunderstand your pain, others may overprotect. Remember that you are independent and can do this.
Some techniques to combat these negative interactions between the mind and body are redirecting your attention to control pain, challenging negative thoughts that support pain, cultivating more positive emotions, slowly increasing your activity, and reconditioning yourself. Further tools for managing pain include more actionable steps. These tools can include exercise, mind-made medicine, ice heat and massage, and medications. Another useful tool is keeping a pain diary, in which you record the date, time, and activity of pain, rate the significance of the pain, and describe it. This is a great way to look for patterns in your pain and identify the source of it.
Shortness of breath can also have several causes. These can include excess weight, smoking, dehydration, and deconditioning of muscles. Luckily, there are multiple things you can do to manage this issue. When you feel shortness of breath, it may be tempting to stop what you are doing or try to finish quickly. Instead, try slowing down, whether it be for a few minutes or for enough time to take any medication prescribed. A few other helpful tips include gradually increasing activity, avoiding smoking, drinking plenty of fluids if mucus and secretions are an issue for you, and utilize the medication and oxygen provided for you if necessary. There are also multiple ways to directly control your breathing. These include diaphragmatic breathing, also known as belly breathing, pursed lip breathing, and huffing. If you have any questions about these methods, please consult a medical professional. Sleep is a time when the body can rest from the day's activities and recharge for the next. Without enough sleep, we can experience fatigue, the inability to concentrate, irritability, increased pain, and weight gain. All of these symptoms can further exacerbate the already existing symptoms of your chronic condition. In order to ensure you are getting enough sleep, focus on how you feel the next day. If you feel alert, well rested, and are functioning well, then chances are you are getting the right amount of sleep for your body. There are a few self-management tricks and tips to help get a good night's sleep. A few things you can do before getting into bed are making sure you have a comfortable bed and sleeping position, warming your hands and feet, keeping the room at a comfortable temperature, using a vaporizer, and making sure your bedroom is a safe, comfortable space. A few things to avoid before bedtime are eating a heavy meal, alcohol, caffeine, smoking, and using a computer or watching TV. All of these things can prevent you from getting a good night's sleep and functioning well the next day. In order to incorporate these tips and tricks into your daily schedule, there are a few ways to establish a routine. Maintain a regular sleep schedule, exercise at regular times each day, get out in the sun every morning, and do the same things every night before bed in order to establish a clear routine. A common sleep disorder is obstructive sleep apnea, although it is very underdiagnosed due to the only noticeable symptom often being loud snoring. However, this is a serious condition as it prevents a person from getting a full night's sleep and can lead to more fatigue and pain. It can even be life-threatening if it goes undiagnosed or treated. If you feel tired all of the time despite getting a full night's sleep and have been told you snore, consider talking to a medical professional. Do not be afraid to reach out for help if you feel your sleep is being compromised in any way. A better night's sleep means a better quality of life.
Depression can occur at many different levels. It can affect the way you may think, interact with others, behave, or the way you function. Some feelings that can cause depression include fear, anxiety, or uncertainty about the future, frustration, and loss of control over your life. Behaviors that can come from depression are the refusal to accept help from others, withdrawal, lack of physical activity, and isolation. There are many steps in treating your depression, which include medications to balance your emotions, counseling, and self-help. Self-help means taking several different actions in order to better your situation. These steps include eliminating the negative, planning for pleasure, taking action, socializing, moving your mood, thinking positive, and doing something for someone else. Anger can become a common emotion when dealing with a chronic illness because it can threaten your independence and control. You can be angry at yourself, the disease, healthcare providers, and family and friends. While anger is a normal emotion to experience when dealing with your chronic condition, it can be diffused so that the anger is dealt with effectively. Some ways to manage your anger can include reasoning with yourself, cooling off, verbalizing the issue without blame, and modifying your expectations. Taking these actions can allow you to deal with your anger so that you can constructively determine what is making you angry. Stress is an emotion everyone experiences from time to time. It can cause your heart rate and blood pressure to increase, tension in your muscles, rapid breathing, sweating, and slower digestion. For these reasons, it is beneficial to learn how to identify common stressors so that you can manage the stress you experience. Common stressors can be physical, emotional, mental, or environmental. When dealing with stress, identifying the stressors in your life can allow you to change certain habits to avoid the stressors present or come up with ways to deal with the stressor so that it does not affect you as negatively.
Itching can be a frustrating symptom that has many possible causes. These causes can be as simple as a bug bite or a result of your chronic disease. For example, liver damage, kidney disease, and psoriasis are all chronic illnesses in which itching is a common symptom. Some things you can do to manage itching include moisturizing with lotions not containing alcohol, using a humidifier, wearing comfortable cotton clothing, taking appropriate medications after consulting your doctor, reducing stress levels, and trying to avoid scratching. If you are struggling with urinary incontinence or loss of bladder control, remember you are not alone. This is a very common issue that can have a variety of causes. Pregnancy, menopause, weight gain, hormonal changes, weakening of pelvic muscles, bladder infections, use of certain medications, or even activities that increase pressure on the bladder can all contribute to urinary incontinence. The three main types of urinary incontinence include stress incontinence, when urine leaks during activities such as exercise, coughing, or laughing; urge incontinence, when sudden and urgent need to urinate prevents ability to go to the bathroom in time; and overflow incontinence, when the bladder cannot empty completely. Knowing the type of incontinence you may be experiencing can help to identify the self-management tools you may utilize to help the problem.
Loss of memory is normal when aging. While it occurs for most, there are some serious illnesses associated with memory loss that are not considered in the process of aging, such as Alzheimer's and dementia. These diseases can cause memory loss to be severe enough that your forgetfulness begins to affect your daily activities. These activities can include your ability to work, perform tasks, or your overall independence. While there is not a cure for these diseases, it is important to be diagnosed as soon as possible so that you and your loved one can get the maximum benefit from treatments. Early diagnoses can allow for you to maintain your independence for longer and make decisions on the care you receive before you reach the point of needing it.
We hope you have found this information on understanding and managing common symptoms helpful as you continue managing your chronic conditions. For more content like this, like Northeast Georgia Health Matters on Facebook. Thank you for watching and have a great day.